Buffalo's got a bright future and an unforgettable past. Buffalo's got Del and Matt on the Talkin' Proudcast. Tune in so you can hear philanthropists and volunteers, good people who live and work in the biggest city in Western New York.
For those of you who are watching this across the interwebs, welcome to the Talking Proudcast. This is a revival of a podcast that Del and I have been doing for, well, technically we've been doing it for 2 years, but we were on a bit of a hiatus because we didn't have a reason to talk Proud for a while, and so that's a great segue into introducing Kim Einhiple.
Yep.
Kim Einhiple, who is a nurse and someone who's right on the front lines of the COVID-19 epidemic and everything that we're dealing with around the world, but especially here in Western New York. So, Kim, I wanted to first of all thank you. Awesome, thank you on behalf of Del and the entire universe. Thank you for being here.
Thank you for having me.
And it's a quick start. If you could just tell us, where you work, what it is you do, kind of what how that relates to what we're talking about now.
Sure. So I'm a nurse, a registered nurse at St. Joe's Hospital, or as it's known right now, the Pandemic Treatment Center. Our whole hospital is dedicated to the treatment of patients infected with COVID-19. I've been at the hospital for about 8.5 years as a nurse, and they gave us all the choice whether we wanted to stay or if we wanted to be kind of parsed out to other facilities, and I chose to stay. So I've been working there for the last 2 weeks under the umbrella of the Pandemic Treatment Center.
Is that a term that you ever thought you'd say, that you work at a pandemic treatment center?
No, not in about a million years did I ever think that I would be doing something as important as this. Not that nursing isn't important, but it feels even more important now. And B, never thought that my little corner of the world, my little hospital, would become something so big.
So you said you were given a choice. If
Yes.
you chose not to, return to work and stay at work, what was the other choice? A layoff, a reassignment?
Reassignment. So you could choose to go to a different facility within Catholic Health. And some of my coworkers, due to their own health reasons, family reasons, things like that, did choose to do that. I'm at a little bit of an advantage. I'm not married, I don't have children, I live by myself. So for me, it didn't feel as dangerous for the people around me as it would for somebody who comes home to a family every day. So I'm a little bit lucky in that sense.
Yeah, I've seen some of those videos that are floating around the internet of nurses or first responders, how they come home and they have to basically like put their hands up to their children and say, hold on, mommy or daddy has to go like change all their clothing and take a shower, and
Yep.
So just hold off. And obviously kids aren't always the most understanding when it comes to stuff like that. It's kind of
Exactly.
Weird. So what does a typical day, a shift look like for you at COVID Central?
So I work 12-hour shifts, 3 days a week. Generally, my days are kind of lumped together. I'll work about 2 days, and then I'll have a few days off. Right now, I'm at the end of a 3-day stretch off of work. So we start at 6:45 in the morning. When we get to work, we change into provided scrubs. That's something kind of new that my hospital instituted because of everything going on. There's less risk of us taking it home because it won't be on the clothing that we're wearing, the scrubs we wear at home. And then we get gowned up. We have gowns, we have masks, we have N95 masks, which are the ones that are like directly kind of suction cupped onto your face. Then we have surgical masks that go over that, and eye protection, and of course gloves. So we are gowned up from head to toe. We're very lucky that right now we do have a good supply of materials that allow us to be safe and protected. But yeah, so right now we're getting patients transferred in from other facilities. We've got patients coming in from Mercy, Kenmore Mercy, or the Sisters that's on Main Street. So we're basically doing everything that we can to help these patients get healthy and home.
Speaking of those patients, a lot of the narrative is that this only really affects the elderly, but I was wondering, what age groups are you seeing at the pandemic treatment center?
Honestly, we've seen every age group. It has not affected, it has obviously affected older people more, but we've seen anywhere from a teenager to a 90-year-old. That's who we've had. So it's definitely not selective when it comes to the patients that require treatment in a hospital.
And I think that's something that's really important to note for anybody who's watching this, and hopefully a lot of people are, is that just because you're young and quote unquote healthy doesn't mean that you're not going to show symptoms or you're not going to need hospitalization because you get so sick from this. So it's something to think about. It's not just a worry about you transferring it to somebody older who could get sick. You yourself are going to need medical treatment because you could possibly get so sick at any age.
Right. Yeah. And I feel like younger people think they're invincible, and, it's not going to happen to me. I'm healthy. I'm not going to need treatment at a hospital. And it's obviously not true. It's affecting every age group.
This has been an opportunity for hypochondriacs and germaphobes to say, I told you so.
Exactly.
So.
Exactly.
In terms of, sorry if I'm coming off like I'm just like rapid firing questions.
No, you're
but
good.
I have
You're
there's so much, it's so interesting. In terms of how you treat like a normal patient, and then you have these COVID-19 patients, what's different in terms of how you're administering care? Or, you just described your protective equipment that you have to employ while you're there, but like, how is that different than what you normally wear? And is there anything different you're doing with these patients?
So obviously our protective equipment is much bigger, much more than what we would normally wear. Throughout a normal day, I wear my own scrubs. I bring them from home. I put them on when I'm at home. I come home and I go to work and I take them. I'm speaking in like circles right now. Sorry.
Oh, you're doing great.
I wear my own scrubs. We wear gloves. We don't, unless we're taking care of somebody who has the flu or something like that, we're not necessarily wearing the masks or anything like that. So there's, you get hot in this protective equipment. I posted a picture not too long ago of what my face looked like after I was done with my shift at work. I am actually bruised. It's probably hard to tell, but I'm bruised along the bridge of my nose. My face gets super red on my cheeks from the protective equipment. And we're wearing the protective equipment, full gown, full gloves, everything, for at least 9 hours of our shift.
Wow.
Of a 12-hour day.
Yeah, I actually have an N95 mask here at the house. I wore that out the other day, and you get hot wearing those things very quickly. I was wearing my glasses. My glasses were steaming up. I don't know if I was wearing it incorrectly or whatever, but it's very, if you have claustrophobia, maybe that's, not, wearing that mask. If you don't have to, maybe don't, but,
that'll induce it, definitely.
Yeah, for sure. But, I've also seen videos where it shows the airflow of someone who is not wearing a mask and someone who is, and it's amazing how much, I don't know what the word is, but how much goes forth from, your face when you're not wearing a mask as opposed to wearing it.
Right. So then in just terms of taking care of the patients, it's supportive treatment right now, because there isn't anything that they found that is, a miracle cure, which we hope eventually something will come about that'll help these patients more than just the supportive treatment we've been offering. But pretty much everybody is on oxygen, nasal cannula. Probably seen people walking around in the grocery stores who have COPD and stuff like that with the cannulas, and sometimes obviously they have to be ventilated, and that is, unfortunately becoming more the norm now, is that we're seeing more patients ventilated being seen. So a lot of it is, like I said, is supportive, and us as nurses, we're trained to notice these like subtle changes that patients have that could be leading them to having to be ventilated. So
in terms of patient care, is there, we just touched on like what's being done, but in terms of like how you protect yourself, do you have any examples of like maybe where you weren't able to do something that you normally would have done or you would have liked to have done, or is there any like anything you could share on that front?
Pretty much anything that we do on a normal day we can do in the gown. It's just a lot hotter, a lot sweatier. You kind of feel like you've got one of those like running jumpsuits on that you're supposed to wear to sweat more.
Yeah.
But a lot of it is is harder to do because you're all gowned up. You're not able to move. Your range of motion is a little bit less, but I haven't encountered anything so far that I haven't been able to do like I would normally.
Mm-hmm. Well, I guess that's good. That's good to hear.
Yeah. It makes us feel better, that our jobs haven't changed too much yet.
Matt, did you have something you wanted to chime in with?
So what I want to know is if there's anything that you want to say to the public or say to anybody who might be watching or listening to this, other than the things we've already mentioned, what they can do to help you, what they can do to help the community, what they can do to help nurses, medical professionals, first responders, et cetera. But, anything that you want to add that you think, people can do to flatten the curve, to use some of the terminology that's going around right now, but anything that you think that people can do to contribute?
Just check in on your healthcare worker friends. I can say a lot of us are not okay right now. We're scared. We don't know what's going to happen. What's going to come down the road. Just check in to make sure they're mentally okay. I mean, it's a huge mental strain on a lot of us. And I know, at least for myself, I have an amazing support system. I have great friends. I have great family who are constantly checking in on me to make sure that I'm okay and that I don't need anything. So please just take into consideration that we may look strong on the outside because this is what we were trained to do, but some of us need a little bit of an extra mental boost sometimes. And in terms of what the community can do, just keep on doing what you're doing. Check in with your neighbors. If they need anything, obviously don't go into their houses, but, check in on your elderly neighbors. Make sure that they're okay and that they have everything that they need. Stay home and just wash your damn hands all the time.
That's a good one. Wash your damn hands. Even if you're not leaving the house, really. Like, yeah. I think, because at some point you're going to go out to check the mail. You're going to go out to pick up a package,
yep.
Things like that. Now, I know you're not I don't even know what the word is, a virologist or Dr. Fauci or whatever. But
right.
So are there any myths out there that people are spreading that you think you can dispel about how it's spread or anything like that? Anything that you just want to like tear your hair out because it's not true or it is, or they're ignoring it, that it is true, etc.?
Just the social distancing thing. I mean, people think that, oh, it's my family. It's okay if I go to visit them. You should not be seeing anybody that does not live in your own house. Like I know I miss my family dearly. They live 5 minutes away and I would kill for a hug from my mom, but I know that I can't. And especially since I'm a healthcare worker and I'm exposed to this every time I walk in the door at work, I'm at a higher risk of transmitting it to somebody. So it's even more important for me to stay away. And I mean, we're so lucky to have technology like FaceTime and Zoom and stuff like that, where we can see our family face to face. And yeah, it doesn't, make up for the fact that you can't give your loved one a hug, but we at least have that sort of communication, and we're lucky to have that. But yeah, that's just stay home, stay home at all costs.
Yeah, louder for the people in the back, right? I mean, it's
right?
Something that just needs to be underscored so much that,
mm-hmm.
I have one more
exclamation points.
Yeah, I have one more question I wanted to ask, just to jump into like some specifics. There's been some talk over the past, 24, 48 hours in terms of how the federal government may end up actually suggesting to the population that if they go out, they should be wearing a mask.
Mm-hmm.
Obviously, we know that there is a need for, PPE for the people on the front line like yourself, first and foremost, but in a perfect world, assuming there's enough for everybody, what are your thoughts in terms of like people wearing masks, and if they do have them at home or they end up having to wear them, Is there a specific thing they need to know in terms of wearing them correctly?
So even just as recently as, 2 weeks ago when this all started, I was at the grocery store buying some last minute things I knew I would need. And I saw so many people walking around with masks just down around their like chins. And it doesn't work that way. It doesn't work that way. You need it over your nose and over your mouth. I know there's
you don't get bonus points just for going out of the house.
Right. But yeah, that's just one big thing that I've seen, and I've seen friends of mine posting pictures of people wearing them like that, and that's not how it works. And then I know there's so many people that want to feel like they're helping, and I have so many friends who have messaged me and said, hey, I'm making masks, which is wonderful. And I know that people in a time like this, and a time of crisis, want to feel like they're being useful. I'm the same way. And just, the one thing that they have to realize is that a surgical mask and a mask that you make at home are two completely different things. I saw a picture earlier today of the weave of what they call a non-woven mask, which is a surgical mask, and the weave of a woven mask, which is something that's made out of fabric you can go in, to Joann Fabrics and buy. And it's the distance between the fibers is so much bigger. So just know that even if wearing a mask is great, and I highly recommend, if you have to leave the house, wear anything that you have. If it's a fabric mask you bought at the store, if it's a surgical mask that you happen to have, wear it, because you're better off with some protection than none at all. But just know that that mask that you make at home is not necessarily going to have the same protection that a surgical mask would. So that's just something for the well-being of everybody to know. But wash your hands, wear a mask if you absolutely have to go outside. I know we've all got things that we need to do, food, is a big one for everybody, but it's just, that's step down off my soapbox now.
No, so good, going in the opposite direction, is there anybody you want to shout out or thank, or you put on a pedestal now to give props to?
My amazing coworkers at St. Joe's. I mean, I know for so long we were called Sloppy Joes, and I hope that this will change people's perceptions of my hospital and just my amazing coworkers. I can't say enough about the family that we have at St. Joe's and how we really are there for each other. We're all checking in on each other just to make sure we're all doing okay. Trying to give each other as much of a break as we can during the workday, and just my family and my friends who have been so incredibly supportive. And I've probably cried every day because I'm coming home and I had a friend that decorated my walkway up to my house with chalk and, we love you and all of that stuff. And I am so lucky, and I'm so blessed. And I know that's so cliche, but I feel so lucky to have the support system.
Yeah, not a cliche at all. Well, I just want to say, not to beat Matt to any punch here, because you can say it as well, but I just want to say thank you, to yourself and to anybody who's listening, who's on the front line, who is, first responder or any kind of healthcare professional who is dealing with this firsthand. And even if you're not dealing with it firsthand, like your livelihood, thank you so much for what you do. I don't think that, enough credit is given, for your choice of vocation and how you choose to, spend your life, and that goes to teachers as well. If there's any teachers listening, like, hats off to you. Like, it really means a lot. And so just, thank you so much for, what you're doing for, Western New York and, obviously the world as a whole.
Basically, I ditto. I honestly thank you so much for everything you're doing, and we're going to talk to some other healthcare workers, hopefully in the coming days and weeks, unfortunately, from other hospitals and Buffalo General, ECMC, et cetera, and hopefully when I'm speaking to them, we're flattening the curve and we're getting ready to start getting back to normal. So once again, Kim, thank you so much for joining us. We really appreciate you taking the time on your day off. And you rest up, and because we know that you're going to be really fighting a good fight and a tough fight when you go back to work this weekend, I guess, at some point.
Yeah, tomorrow.
All right. Well, thank you very much. You are blessed, and hopefully more blessings come to you. And I'm sure Del would agree that some people deserve it more than others right now, although we all do. But you're deserving as much, if not more, than anybody. So good luck.
Thank you. I appreciate it. Thank you guys so much for having me.
Oh, absolutely. Thanks for coming on.